Hello, my name is Dr. Pamela Pine, and I'm the founder and CEO of Stop the Silence. By background and training, I'm an international public health and communication specialist, and I've worked on some of the most difficult problems around the world, from Latin America to Oceania and every continent in between. 20 years ago, I started learning about the then nearly silent epidemic of child sexual abuse. And the more I learned, the more horrified I became, and the more I realized something had to be done to reach all populations with information to increase understanding and action on prevention, treatment, and mitigation. At that point, 20 years ago, little was being done on CSA due to the sense of individual and public shame, stigma, fear, and the political realities surrounding the health and safety of women and children. I founded Stop the Silence as a nonprofit organization in 2004 to address the need. While funding has always been extremely difficult to obtain, we've managed these past 20 years to first focus on raising awareness so that public, policymakers, stakeholders, and others could start talking about CSA and build toward action with major events like Race to Stop the Silence, a timed foot race with prizes and elite and other runners and advocates, which took place for 10 years between 2004 and 2013, and involved at its height over 1,200 runners and walkers, and major TV, radio, and social media, like PBS, ABC, NBC, CBS, as well as public TV, radio stations like Clear Channel Radio, now iHeartRadio, and NPR, major newspapers and magazines like the Washington Post, and of course, all of the social media. Since those early days, we've conducted important research, provided critical information to publics, organizations, and governments throughout the world, conducted training for thousands, and have developed a model to comprehensively address the prevention, treatment, and mitigation of CSA, as well as other adverse childhood experiences, or ACEs, that involves advocacy, education, training, and policy development and reform. The model has been and is being successfully implemented in various places in the world. Over the years, despite the constraints, we've received support from the likes of the Department of Justice and the U.S. Health and Human Services, the Robert Wood Johnson Foundation and the Ford Foundation, and corporate entities like Pepsi and Adam and Partners Investment Advisors. While CSA is now less silent, there's so much work left to be done. We're greatly looking forward to starting this new chapter as a department of the Institute on Violence, Abuse, and Trauma. Thank you, Sandy Capuano-Morrison and Bob Geffner, the board of the Institute on Violence, Abuse, and Trauma, and the IVAT staff for your collaboration and leadership over these years and for taking on this new endeavor. We are hugely excited to start this new chapter as a part of IVAT's ongoing work. We'd like to share this very short video with you next. It was created for an application to the MacArthur Foundation, and it provides a bit of what we're doing and with whom. Thank you.
Buenas tardes, my name is Forca Nac. I'm the president of the NGO IA Desblanzal in Peru, and together we want to put an end to child abuse in our country.
Kamil Alai, co-president of Institute for International Health and Education, which we are working in over 12 countries, including Iraq and Tajikistan.
Hello, my name is Monty Thomas. I'm a social traumatologist from the Zoe Life Institute in South Africa.
I'm Najla Shihab, founder of Anybody.org from Indonesia.
Hi, I'm Joyce Fan, director of the NTU Children and Family Research Center in Taiwan.
My name is Akira Marcella Thompson, Chief Executive Officer of Trust My River, New Zealand, Samoa, and Australia. And I am a child sexual abuse survivor.
And I'm Dr. Pamela Pine, co-director of the Institute on Violence, Abuse, and Trauma's Speak Up, Stop the Silence program. Our worldwide coalition will expand tested, evaluated, risk-focused awareness, training, and education programming using sensitive electronic and hands-on approaches to CSA prevention, service access, and mitigation affecting millions. This story today on IVAT's application to MacArthur Foundation's 100 and Change.